The national debate over health care reform has been contentious, to say the least. Many opponents to the congressional proposals have argued that they will negatively impact small business. But there are others who say just the opposite, that what is being proposed will actually help small companies. The nonpartisan Main Street Alliance, which is made up of dozens of state-based small business coalitions, is holding events around the country focusing on this issue. Dave Mason is the legislative and policy director of the Main Street Alliance, and Kelly Conklin owns a woodworking business in New Jersey. Kelly testified before Congress on healthcare costs and their impact on small business owners. Thank you both so much for joining me. I really appreciate this.
Thank you.
Thank you.
Kelly, I want to start with you. Your company is how big?
We have 13 employees, and my wife and I are also in the company.
And you provide health insurance?
Yes, we do.
So what problems are you experiencing?
Well, every year our rates go up 20 to 30%. We're currently spending just under $5,000 a month on health insurance. It's an enormous burden. There's a level of unpredictability that impacts us all the time. And
are you happy with what you're seeing out of Washington right now?
I'm happy with what I've seen out of Washington in terms of H.R. 3200. I think it's a great bill. It met many of the requirements, many of the things we were looking for in the Main Street Alliance. We want affordability. We want access. We recognize that the small business community, Americans, are all in this together, and we're all going to have to contribute to make it work.
You know, Dave, I want to ask you, a lot of people out there are saying these proposals aren't going to help small business. They're actually going to hurt small business. A lot of small businesses are saying right now, I don't have the money to afford health care, and if you then make me buy health care, or if I'm over a certain size, contribute a percentage of my payroll to contribute to health care, I'm going to go out of business.
Well, I think the answer to that really is that there have to be affordable options for small businesses and for individuals if health care reform is really going to address the problems that Kelly and other small business owners are facing. We understand the concerns, the fears about having to contribute more than folks feel like they're contributing currently. But I think we all have to recognize that the lack of affordable options in the marketplace is costing everyone money currently, whether it's through uncompensated care or unpredictable premiums. So we see the bill moving in the right direction on that issue.
Is there anything that is missing in the bill right now that you'd like put in?
No, I think the bill that Kelly referred to, the America's Affordable Health Choices Act in the House, really has all of the key elements that we think are important. A better marketplace, a health insurance exchange for small businesses and individuals to purchase coverage, and a public health insurance option that we see as really essential to creating affordable options, driving down costs, and really holding insurers accountable. We don't think that greater regulation of the insurance market on its own is going to be sufficient to change the marketplace and create the affordable options that Kelly and others need.
All right, so you just brought up one of the most contentious issues, which is about the public option. And Kelly, you and I were talking about this a little bit before. If the public option is taken out of the bill, do you think the bill is robust enough for you?
No, absolutely not. The public option is key. The public option sets a benchmark. When I go out and tell my employees what we're going to provide in health care coverage next year or this year, I really don't know. And one of the key components of the public option is it will set a benchmark. So every single American will know if you're buying health insurance, you go into the hospital, you come out, the biggest bill you'll ever pay is $5,000. That is an enormous improvement. Without the public option, that will not be part of the solution.
So Dave, what are you guys doing to, as a group, try and ensure that that stays a part of any reform that passes?
Well, I think really the activity that you referred to at the outset for this Take Action Week that's coming up is to make sure that people really understand what the bill does. There's been a lot of misinformation about the legislation, and so our intent through these various different activities our members are engaged in is really to make sure that people understand what the bill does for small business, the way that it addresses some of the problems that they're facing currently, and really to try to take advantage of a comprehensive solution to the problem. If we try to do this in a piecemeal way or hold things up, as Kelly kind of indicated, the problems will only get worse for small businesses.
You know, you say there's a lot of misinformation. Are there a few facts that you want to clear up right now?
Well, I think Kelly kind of touched on it. In order to really change the marketplace and create truly affordable options, we do believe that everybody needs to be part of the solutions, all of the stakeholders in healthcare insurance. We do think that greater regulation of the insurance marketplace to prevent some unfair rating practices needs to be be there. But we also believe that in order to change the economics of the marketplace, a public health insurance plan will provide options that just currently aren't available to folks.
And Kelly, I want to ask you just one last question.
Sure.
If nothing changes and your premiums continue to go up, will you reach a point where you can't provide insurance? Right now you pay about 85%, where you can't provide insurance for your employees anymore? Absolutely.
I mean, we're talking about a doubling of our premiums, $10,000 a month by 2018, is it, Dave? I mean, it's just outrageous. We can't keep going this way.
All right. Well, Kelly and Dave, thank you so much. We've obviously been talking a lot about this here, and we really appreciate your input. Thanks a lot.
Thank you, JJ.